Monkeypox is a zoonotic virus, meaning it can be transmitted from animals to humans. Here's how monkeypox typically spreads to humans. Transmission from animals to humans. Direct contact with infected animals. Rodents. In regions where monkeypox is common, such as Central and West Africa, the primary reservoirs are rodents like squirrels, rats, and mice. Primates. Infected primates, such as monkeys or apes, can also transmit the virus. Direct contact with these animals' blood, bodily fluids, or lesions can lead to infection. Handling infected animals. Contact with the blood, body fluids, or tissues of infected animals during hunting, preparation, or consumption of bushmeat can spread the virus to humans. Transmission from human to human direct contact with infected individuals. Body fluids. The virus can spread through contact with the bodily fluids of an infected person, including respiratory droplets, which can occur in close contact settings. Skin lesions. Direct contact with monkeypox sores or lesions on the skin can transmit the virus. Contaminated objects. Bedding and clothing. The virus can also spread through contact with contaminated objects like bedding or clothing that have been in contact with an infected person's lesions or body fluids. Respiratory droplets. Close proximity. In rare cases, monkeypox can spread through large respiratory droplets during prolonged face-to-face contact with an infected person. Environmental transmission. Contaminated surfaces. Though less common, the virus can potentially be transmitted via contact with surfaces or objects that have been contaminated with the virus. Precautions to prevent transmission. Avoid contact. Avoid handling animals that may be infected, and practice good hygiene if you come into contact with animals or animal products. Isolate infected individuals. Those with monkeypox should be isolated from others to prevent the spread of the virus. Use protective equipment. Use gloves, masks, and other protective gear when caring for infected individuals or handling potentially contaminated materials. Understanding these transmission pathways helps in taking appropriate measures to prevent the spread of monkeypox. If there is suspicion of infection, it is important to consult healthcare professionals for diagnosis and management. Monkeypox is a viral infection that primarily occurs in certain regions of Africa, but has spread to other areas in recent years. Here are some detailed measures for preventing and managing monkeypox. Vaccination. Vaccines. Although there is no specific vaccine for monkeypox, the smallpox vaccine, such as the Jynneos or ACAM 2000 vaccines, has been shown to provide some protection against monkeypox. In certain situations, especially during outbreaks or for high-risk individuals, health authorities might recommend vaccination. Good hygiene practices. Hand hygiene. Wash your hands regularly with soap and water, especially after coming into contact with potentially contaminated surfaces or after touching your face. If soap and water are not available, use an alcohol-based hand sanitizer. Respiratory hygiene. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing. Dispose of tissues properly and wash your hands immediately afterward. Physical distancing. Avoid close contact. Monkeypox spreads through direct physical contact with an infected person or their bodily fluids. To reduce the risk, avoid close contact with individuals who have symptoms of monkeypox or who have been diagnosed with the infection. Avoid contact with animals. Monkeypox can also be transmitted from animals to humans. Avoid handling animals, especially if they appear sick, and follow local health guidelines regarding animal contact. Sanitation and disinfection. Clean and disinfect. Regularly clean and disinfect frequently touched surfaces, such as doorknobs, countertops, and electronic devices. Ensure that any materials or surfaces potentially contaminated by an infected person are thoroughly cleaned. Launder contaminated items. Wash clothing, bed linens, and other fabrics that may have come into contact with an infected person using hot water and detergent. Seek medical advice. Consult healthcare providers. If you or someone you know develops symptoms of monkeypox, such as fever, headache, muscle aches, backache, swollen lymph nodes, or a distinctive rash, seek medical attention promptly. Early diagnosis and management can help reduce the severity of the disease and prevent its spread. Follow medical advice. Adhere to the advice given by healthcare professionals, including any recommendations for isolation or treatment. Stay informed and follow public health guidance. Monitor updates. Stay updated with information and guidelines from local health authorities and the World Health Organization, WHO. Follow any public health advisories or recommendations related to monkeypox outbreaks. Participate in awareness programs. Engage in community awareness programs that provide information on preventing and managing monkeypox. Prevent animal-to-human transmission. Avoid contact with infected animals. Monkeypox is known to be transmitted from infected animals, such as rodents or primates, to humans. Avoid touching or handling animals that appear sick, and avoid contact with their bodily fluids. By following these preventive measures, you can reduce the risk of monkeypox infection and help protect yourself and those around you.